guarantee I made the perfect incision. I've got the little cannula down that's like the size of my pen. In fact, my pen won't even fit that down this thing. Here's the endoscope. It's under continuous irrigation. You see this water right here? That's old man pee-pee right there. And then I'm going to be able to put it right in here and then look up there. All right, here's what it looks like when you first look in here. So inside is where the canal is. 12 o'clock is medial or toward the middle. That's the disc. That's my entry point of the cannula, so that doesn't count. And I'm looking for the empty tent sign. There it is right there. Yep, right there. Right there. Yep, look at that. This should be like a hockey puck. Empty tent sign all along here. And look at all these adhesions. And this is the element probe, radio frequency probe. It's curved and directable. Cannot do this surgery without this device. Impossible. The laser is a luxury, but I can't do it without the laser, but a lot of other surgeons can. Okay, now my favorite instrument, the sci-fi homing laser. Look at how magical the laser is. The best thing about the laser is that I can be right next to the nerve. As long as I'm not lasering it, it's fine. It's because it's not electrical. Whereas electrical instruments, you don't have to be right on the nerve. You can be near it, and the conduction of the electricity can shock the nerve. So this is a really good adjunct to all my existing instruments and armamentarium. Okay, I'm heading toward the annular tear. Look how blue it is way back here. That should be white. Unless you have an annular tear. That's all I'm saying. Look at how well this laser works. It's crazy. So if you look right here, that's the epidural fat, and on the other side of that is the canal, right here. I went all the way to the midline, made sure that all the nerves are free. That's the empty tent sign, and underneath was all this stuff right here. Alrighty, all done, looking around. That's the dural tube over there. Lots of inflammation and scarring, but I released it all. This was where the empty tent sign and annular tear was, and I evacuated everything underneath there. So I'm really happy so far. I got to everything, and I'm really expecting you to get a whole lot better. All right, teeth surgery's all done. It went perfectly. We did that little incision, and we can put a little cute band-aid on there, which is just so cool, because we never put band-aids on wounds when I was in training. So, best wishes for a speedy recovery.